Welcome to the channel. If you enjoy tech insights and helpful tips, please subscribe. Let's begin.
Flushing a Jackson Pratt, JP, drain without a stopcock requires meticulous technique to maintain sterility and patient safety. This video will guide you through the process, emphasizing critical steps to ensure a successful outcome when a stopcock is unavailable or non-functional. First, gather all necessary supplies. A sterile 10 to 20 milliliter syringe, sterile normal saline, alcohol wipes, sterile gloves, sterile gauze, a sterile hemostat or clamp, and potentially a new sterile collection bulb if the existing one needs replacement. Always begin by explaining the procedure to the patient, ensuring their comfort and understanding, and position them appropriately to expose the drain site. Perform thorough hand hygiene and don sterile gloves. The most crucial initial step is to clamp the drain tubing with the sterile hemostat. This clamp must be placed distally, close to the connection port you intend to disconnect, but far enough from the patient's skin to allow manipulation. Clamping prevents backflow of fluid from the patient and maintains the negative pressure within the system once disconnected. Next, meticulously clean the connection point between the drain tubing and the collection bulb using an alcohol wipe, allowing it to air dry completely. With one hand stabilizing the tubing, carefully and aseptically disconnect the collection bulb from the drain tubing. It is paramount to keep both the open end of the drain tubing and the collection bulb port sterile. Avoid letting them touch any non-sterile surfaces. Immediately prepare your syringe by drawing up the prescribed amount of sterile normal saline, typically 10 to 20 milliliters. Gently insert the tip of the saline-filled syringe into the open end of the drain tubing that leads to the patient. Slowly instill the saline. Observe for any resistance. If encountered, do not force the fluid. Gently pull back slightly on the syringe plunger and try instilling again. The goal is to flush any clots or debris that might be obstructing the drain. Once the saline is instilled, carefully remove the syringe. If you are reusing the existing collection bulb, clean its port again with an alcohol wipe. Then, aseptically and securely reconnect the collection bulb to the drain tubing, ensuring a tight seal. If you are replacing the bulb, connect the new sterile bulb following the same aseptic technique. After the connection is secure, release the clamp on the drain tubing. Finally, compress the collection bulb fully to reestablish negative pressure within the drain system, ensuring the bulb remains compressed to maintain suction. Observe for immediate drainage and secure the drain tubing and bulb to the patient's clothing or skin as per protocol. Properly dispose of all used materials, remove gloves, and perform hand hygiene. Document the procedure, including the amount of saline flushed, the character of any return fluid, and the patient's tolerance. Always prioritize sterility and patient safety throughout this process, consulting with a supervisor if you encounter any difficulties or uncertainties. Thank you for watching, and please remember to like and subscribe for more helpful clinical tips.